Look, at my age, you know I've been to a lot of doctors. Healthcare partners, they really care. They're concerned about your health. They're all the best. I am Roberta, and I am a healthcare partner. Visit hcpnv.com to hear my story.
News 46 is brought to you by Comfort Hospice Care, where we give our patients and their loved ones peace of mind, knowing we provide the highest quality of care 24 hours a day, 7 days a week. For more information, call 751-0349.
Tonight on News 46, a car strikes a power pole on Charleston Park. A meeting is held for Silver State Health Insurance, and a suicide prevention awareness walk is being held this weekend. News 46 starts now.
You're watching KPVM News 46 with Monique Mitchell. Local coverage from Deanna O'Donnell. News 46, local coverage you can count on.
Good evening. It's Tuesday, September 10th, 2013. I'm Monique Mitchell for News 46. Well, a sedan struck a power pole last night on Charleston Park, injuring the driver, the only occupant of the vehicle.
Tonight's accident report is brought to you by Stovall & Associates. Don't expect insurance companies to have your best interest in mind. Stovall & Associates cares. Let us help you if you have been involved in an accident.
A single vehicle accident occurred last night off Charleston Park and Highway 372. Pahrump Valley Fire and Rescue arrived on scene to find one vehicle that had struck a power pole. One person was inside the vehicle claiming injuries. The male driver and only occupant of the vehicle was transported locally here to Desert View Hospital. Nye County Sheriff's deputies blocked traffic in all directions while the investigation was being conducted. Valley Electric was also called on scene for the power box that was located on this pole. There had been a previous accident at this location in which power was knocked out as a result of the collision. The driver had reportedly said that he lost control around the bend on Charleston Park and the car fishtailed, which caused him to strike the power pole. This is Deanna O'Donnell for News 46.
Well, the director of Silver State Health Insurance Exchange and Nevada Health Link presented information regarding the upcoming change in health coverage as a result of the Affordable Care Act.
That individual that was making $18,000 a year that we talked about, where the premium was $65, that $2,000 deductible was also reduced. Okay. Now again, I'm not sure exactly how much, but you're talking at that point they're probably between 150% and 200% of the federal poverty level, so you're probably looking at several $100 deductible. Yeah, the Affordable Care Act has 10 titles. Title I is about insurance reform, and subtitles D, E, and F are about exchanges. Title II talks about Medicaid reform and Medicaid expansion. And as you'll recall from the June 29, 2012 Supreme Court decision on the Affordable Care Act, the Medicaid expansion decision became an optional decision. The state of Nevada has opted into Medicaid expansion, so Medicaid eligibility has gone from the current eligibility requirements up to 138% of the federal poverty level for anybody. So for an individual making less than about $16,000 a year, or a family of four making less than about $32,500, they would be eligible for Medicaid. So most of them are probably eligible for Medicare Part A. Probably, yes. There's a few pockets of individuals over age 65 and older that aren't eligible for Medicare Part A, and they would still, if you're not eligible for Medicare Part A, or some other kind of government program, then you would be eligible for coverage through the exchange.
Through an exchange, they would be eligible.
They would be if they are not eligible for a government program like Medicare Part A, TRICARE, VA, Peace Corps, employer-sponsored insurance, state insurance. If you're covered under one of those or eligible for one of those plans, you are not eligible for the advanced premium tax credit. But most of the folks that you're talking about are eligible for Medicare Part A and are enrolled in Medicare Part A, so they would not be eligible for the tax credit. They're already getting a fairly hefty subsidized program. Now, whether or not, I don't know what changes are in store for those programs. My understanding is on the Medicare Part D donut hole that donut hole is shrinking, so that should be good news. But I don't know if there are offsets in provider reimbursement rates in other areas. Well, so I think the news for seniors is that there are relatively minimal changes happening to Medicare.
Well, it's been a frustrating few days for unemployed Nevadans who say they have not been able to file their claim. The Nevada Department of Employment, Training and Rehabilitation upgraded their 30-year-old system and converted to a new one. The department says the majority of claims have been processed, but some people say they have yet to receive a check, and now they're on their second week without money. The department says 600 lines are open to take calls on top of an automated system. The new online system is up and running, but it's only working in increments to prevent it from crashing. The office asks recipients to be patient. If you are filing a new claim, officials say to try online. With a continuing claim, use the phone lines. Well, the stigma surrounding issues of mental health and suicidal behavior still stands as a sad barrier to treatments proven to save lives. Today, a global event aims to blunt that stigma and raise awareness that suicide is preventable. Today marks the 11th annual World Suicide Prevention Day. Suicide claims more lives than war and homicide combined. Saturday's Memory Walk in Hope will call attention to the treatable mental health issue that underlines most suicide attempts.
The group actually has been in existence since 2005, and we work closely together with the Office of Suicide Prevention here in Nevada. Our primary goals are to promote awareness of the issue of suicide as a public health issue, and also to provide training to the community. One of the things that we have to do is just allow people to be able to talk about it. There is a lot of stigma around suicide, and just to open up the conversation can sometimes be difficult, but it also can be very, it's necessary in order to, remove the stigma. We're definitely doing a lot of fundraising. We're promoting our training. We have a couple of training programs through Living Works Education. One is called Assist and the other is called Safe Talk. Both of those programs are about suicide awareness and suicide intervention skills. Those are taught several times a year in Clark County and up in northern Nevada, and we also do it across the state. Definitely working on some initiatives in other areas. We're reaching out to communities like the veterans, problem gambling, the LGBT community, areas where suicide is a very prevalent thing, although we recognize that there's nobody that's not at risk for suicide. So we want to make sure that we're reaching out to everybody.
What's the statistics right now look like as far as suicide rates? Nevada is always kind of ranked high, actually, in suicides, and as well with the economy, it seems to have increased.
Actually, for a while, Nevada was first in the nation. Right now, we're at number 4, and even through, the economic downturn and all the foreclosures and things like that, we were still able to get from 1 to 4 during that time. So, the coalition and the Office of Suicide Prevention are doing really good work in that area. You would have expected to see the numbers get a lot worse during that time, and they're kind of staying, they're staying in that 4 to 5 range.
You have a Walk in Memory, Walk for Hope coming up in Henderson and here in Pahrump too as well. What is that about?
The Walk in Memory, Walk for Hope is our annual awareness event. It's a walkathon basically. It happens this year it's happening in 11 communities across the state. There are people in all of those communities. They're going to walk on the same day at the same time, kind of in state solidarity for the issue of suicide prevention. This is the third year for the walk in Pahrump, and the 7th year for the walk in Las Vegas. So that is kind of bringing the community together to kind of promote some hope and also to reach out to the survivors of suicide who have lost a loved one. The funds that are raised for the walk will help to, fund the walk the next year, and also, all of our fundraising efforts go to support our training programs so that we can provide that training across the state at low or no cost.
All right, folks, we'll keep it here because we're going to have more local news for you after this break.
This portion of the news is brought to you by Children's Dentistry of Pahrump, specializing in sedation dentistry, now accepting adult patients. Call now for free IV sedation with dental implant, 751-2184.
Welcome back to News 46. Nevada Highway Patrol Trooper Jeremy Elliott gives some advice for a common cause of rollover accidents on the rural roads.
I'm Trooper Jeremy Elliott with the Nevada Highway Patrol, and today I'd like to talk to you about lane departures, or overcorrecting when your vehicle does leave the roadway. This is caused by many things, either debris in the roadway that you see and you swerve to avoid. It's also caused by distractions, which could be many things: eating, putting on makeup, hygiene. People comb their hair, brush their teeth while they're driving, believe it or not. It can also be caused by simply adjusting the radio. It can be caused by texting and driving. There are many, many things that distract you while behind the wheel. Here in the Pahrump area, there's not much shoulder to work with when your car does depart the roadway, and that creates challenges for the drivers. What I recommend is that you hold the wheel firmly, keep that vehicle straight, and brake. That will cause the vehicle to brake in a straight line, and if you try to jerk the wheel, that causes the rollover situation, and we don't want that to happen. So again, keep your hands firmly planted on the wheel, ride that out with the brakes, and the vehicle will come to a safe stop. Again, we'd like to remind our community that 0 fatalities is our goal, and we'd like you to be a part of that.
Well, it's become more apparent that the fuel economy estimates on new car windows are often very rough estimates. In a 2012 Consumer Report survey, mileage was the top consideration for would-be buyers, viewed as more important than a vehicle's quality, value, or safety attributes. The focus by automakers and buyers alike on better fuel economy has regularly been causing the average mileage of new cars to inch upward. New cars sold in August averaged an all-time high of 24.9 mpg compared to around 22 mpg in 2010. Well, downtown Las Vegas gets a new neighbor as Zappos officially opens at the former City Hall. About 1,400 employees will fill the new headquarters, bringing lots of business to bars and restaurants. Well, folks, keep it here because we're going to have more news after this break.